Well, the sooner you detect any cancer, the greater your chances are of surviving it. And that's why doctors always stress how important it is to be screened regularly. So as we can continue our conversation this week on colorectal cancer, we're looking at how it's diagnosed. Dr. Veena Nandagam is a gastroenterologist at LeBauer Healthcare. She's a member of the Cone Health Group, and she's here today to talk to us about how to diagnose and when symptoms do appear for colorectal cancer, what they're like. So good morning to you.
Good morning. Thank you for having me.
Oh, thanks for being here. Lots of folks, dread the colonoscopy, the drinks. But once you've had it done and you reflect, you're like, maybe it's not so bad, right?
Absolutely. I
mean, you have the drink, you have the experience, and you don't even remember the experience.
That's the best part. So colorectal cancer is preventable and it's treatable if detected early. A lot of times colon cancer does not present with symptoms, or if they do have symptoms, most common symptoms are rectal bleeding, change in bowel habits, sudden weight loss, or loss of appetite. But the best way to prevent it or detect it early is getting a colonoscopy or screening for colon cancer.
If those symptoms start to appear, a lot of people say, well, it's just so late. If you already have blood in your stool, or if you have that bad abdominal pain, but you need to act fast regardless.
Yes, absolutely. Always listen to your body, and if something's different, talk to your primary care physician who can refer you to a specialist or look more into it so you get the appropriate testing done and the recommendations from a gastroenterologist. The main modality would be to visualize the lining of the colon. If there's something concerning, can do the colonoscopy where we look inside with a small flexible tube which has light and camera at the tip of it. Make sure we take a good look. If there is a tumor, we can biopsy it and test it. Or if there are polyps, which are small growths, they look more like mushroom tops, and we can take them out during the colonoscopy, thereby prevent them from growing any bigger or eventually turning into cancer.
And a lot of times, I mean, you get those polyps and they're just a snap to take out, and you don't even know it.
Yes, and for the colonoscopy, we do it under anesthesia. The whole procedure takes about 20 to 30 minutes.
You're asleep the whole time.
Sleeping the whole time, and you wake up as soon as the procedure is done, can eat the same day once you recover. We monitor for about half an hour after the procedure, and you get to go home, eat a meal. The main part is getting the bowel prep before the procedure, like you were saying. That's what most of our patients find it inconvenient, but preventing colon cancer is much better than
than not. I mean, you don't want to be diagnosed with something down the road, and have to fight it. It's much better to be preventive, for sure. Thank you so much for being with us this morning. We do
Thank
appreciate
you for having us.
Good
My
information. You can learn more about colorectal cancer, by the way, at the Strolling Colon events that are offered all across the Piedmont by Cone Health. There is a 12-foot, believe it or not, inflatable colon. It sounds kind of crazy, but it's very interesting to walk through, and it teaches you how to prevent colon cancer. It's happening Saturday, March 9th from 11 to 2 at Holly Hill Mall in Burlington, but there's also one taking place the following Saturday, March 16th at the McGirt-Horton branch of the Greensboro Public Library on Phillips Avenue. And on Monday, Cone Health is hosting an education series on early detection and surgical approaches to colorectal cancer. That will be at the Cone Health Cancer Center at Wesley Long Hospital from 6 to 7 at night.
House Call on Fox 8 is sponsored by Cone Health.